Mm. Vocal health. There we go.
Dumbass.
Well,
Hey!
hello.
Hello.
Look at that hair. My
Hey.
goodness. You need a COVID cut.
I know. On purpose, though.
I like it.
Well,
Yeah.
I gotta go with it now.
Yeah.
I've had too short. Why manage it now? It's just on its own, right? It's like the beer.
Doing its own thing.
All right. Well, how you doing? How's life? You're back at work?
Yeah, about 3/4 of the way back to full speed. So just my second week, but it's speeding up.
Wow.
Yeah.
People are coming in?
Yeah. We've had such a backlog of Dr. Osborne kind of worked virtually through all that time, and doctors, they couldn't see anybody. They couldn't scope or look at the tonsils or even have anyone open their mouth, really. So they just pushed everyone to home virtual work. And so once we got back, we had a lot of people that needed to be scoped and a lot of people that needed to actually be checked out. So we've kind of gone through that list slowly, and it's coming. The city's a little slow to return, but.
And you're in Peel, or are you in Halton?
I live in Halton, but the office is in downtown Toronto.
That's not fair. So you're now going to be in phase 3.
Yeah, the kids and everybody, they get to, where you go to shop is okay, but not downtown, not yet.
No, we're still in phase 2 as well because we're in Peel.
Right. Yeah.
And Carrie's in Nashville, so she's like wide open.
No, they yanked it back into phase 2 because all the yahoos were coming down here to the bars, drinking and carrying on without masks, and it got 4th of July got canceled, everything. So and now we're still in phase 2, and now the big hoopla is schools and mask wearing, and because certain lifts are coming off, and are they going to keep that in? But okay, wait, when you said, I had this visual of when you said patients and not being able to see vocal cords, and there's part of my craziness as an opera singer that would have been like, if I needed you to look at my cords, we might have gotten on Zoom with the dental mirror and the flashlight and like, can you see in there?
Oh, come on. I know a singer friend of mine actually bought so she said, a portable camera that she can look at her cords. Is that true, Aaron?
I tried that. I bought one off of some, cheap website or whatever that's just a camera. But you got to be pretty tricky because the gag's got to be almost delayed, and then they'll try to push the scope in just over their tongue and curve it like that. And then it's hooked to maybe their computer.
Oh.
To look, you basically see just the general anatomy, but we use strobe lights and we use things in slow motion. So, it's not detailed, but it's a scary look, I guess.
Well, tell us where you are. I mean, it kind of is broadcasted there behind you, but where are you and what do you do and what would you call yourself? How about that?
I own the voice clinic. So we have a clinic where we work together with an ear, nose, and throat doctor. His name's Dr. Alex Osborne. And Alex works both pediatrically and with adults, but he's got all the medical aspects of what we need. And I'm a speech language pathologist that I specialize or just work specifically with voice. And so my work complements his in that we know patients that come in get checked in Canada for cancers and for tumors and for major issues. And then once that's cleared, then they can come through speech pathology and access voice therapy. But I also help with singing artists and different types of artists of different genres who fall into problems that aren't pathological. They're predominantly tension or technique based, and we can start to sort of change those things that would be impeding their skill, their sound.
Okay, that works for me.
All therapy in my hands, and then he's all medicine, and yet it's a good team. That's what you always need, is a team with a doctor and a therapist.
But you not only talk to people as a speech pathologist, but you use your hands, and you are truly unique in that you use your hands to actually massage the jaw, the neck, all of these muscles yourself, correct?
Yeah. Yeah, when I was trained, it was an early stage of all this, just the very, very beginning. I would have been the first student trained in it. But it's to reset the voice, or what Nelson Roy called reposturing. So if your voice box got kind of crumpled together, and it's supposed to have a space between there and there, and it's supposed to have a space between there and there, and then there's supposed to be room for it to move around a little bit. A lot of our tension points in the body and the neck and the jaw and the tongue can shift things and make something too tight. And then we just keep training exercises that aren't working. So the exercises are usually singing exercise, vocalese, saying, okay, I'm trying to do an arpeggio or a scale. This is like running over the hurdles really fast. And yet if your hamstring is tight and you can't get over one hurdle, you're not supposed to practice hurdles at this point. We've got to get out of that and get some therapy in there. So I take the voice box, and over time I've learned where the points are that can be released quickly, how much that speed versus maybe technique of the person's speech, breathing, their life and the amount of stress that they're in, where they think their voice is and where they think exercises should be, but really they might be misinterpreting it a bit and doing them wrong. So a lot of the exercises out there and the things that people know from the internet might be general in knowledge, but the way you do them or the exactness of them that's much different then. So if we say we're doing a trill wrong, okay, you could be doing a trill and creating a problem that you didn't know you were even doing at the time. So a bit of it is exercises and stretching and working the voice, very much like physio and kinesiology would work a leg or a hamstring. And then I manually release it around the thyroid gland, your carotid arteries, your parathyroid, your swallowing at the time, all these things are happening in this little small center. So it becomes a very focused massage. It's a manual release of the cricothyroid muscles or manual release of the thyrohyoid muscles. And those muscles will specifically lend to this problem or that problem, so that we can take the picture of the patient and the problem and then say, okay, I think it's this and this, not what might be diagnosed as reflux and
right.
Something, right? Like
magic hands.
I don't know. I'm curious. I know you and I met before through Sandra in Toronto, and a lot of what manual things you did on me were things that were similar. Some were new, but similar to what I experienced here in Nashville when we found out that I had some muscle knot. I called them muscle knots, like what you get in your back. And he paired me with physical therapists that he had trained. So there's this voice clinic here in Nashville, and they also work on all kinds of instrumentalists and musicians, but they are trained physical therapists. So, but they specialized in this as well. So is that the same thing, or are we talking two different things?
It's similar. It's like the physical therapy teams are coming into this field because the speech pathologists, I don't think, are driving it as much. And if we can train physical therapy to then do sound analysis and video stroboscopy and all that, they would take it away from us.
Oh.
But we need that to be ENT and speech pathology driven. So we're using RMTs in certain provinces, or we're using a physiotherapist in certain provinces because there might not be interest from a speech pathologist in Canada or certain states.
Okay.
And they might not have any training because there's very few professors that are really training it deeply, like giving you 3, 4, 5 months of training under a practica setting. But a big Vanderbilt University has a lot more staff and a lot more kind of power. And that will help that too.
What I loved was they had, the doctor teams that would do the surgery and all that they also paired it with somebody like Tom Cleveland, who understands the same thing you do. And does that make sense? And then he took that knowledge and trained the physical therapist, had people under his wing, so that actually when I was sent over there, only 2 people were allowed to touch me that understood and knew what I did for a living and could help me. And Sandra had been talking about you for years, and I was like, I'm like, it's on your head. What are you talking about, girl? And then when this happened, when my physical injury happened to me and it manifested itself all the way up my body, is when I fell into this world, and I thought, she's right. I'm really sorry, Sandra. I love you. Forgive me. And B, why isn't anybody else talking about this? Because it made me think back over the years of other singers I've worked with who I knew were in trouble or ended up not singing anymore. And I thought, if they had known this knowledge, maybe they would have still been singing. Yeah. So anyway, we're really glad to be able to talk to you today because we wanted to get this information out there.
Yeah. No, and it's common. I've come into a session with a patient going, okay, I'm a pro opera singer, but I haven't sung in 15 years. They're like, oh, why? I lost all my range and I haven't been able to sing for 15 years. Like, no, you can't lose singing. It's in your brain. There's singing in your brain. So your instrument got rusty somehow. How did it change? What happened 15 years ago? We go back psychologically. We go back to their life back then. And that's really part of the job, is to sort of pull away from, it's not a pathological issue. It's not, there's no disease. There's no nodules. There's no polyp. There's no viral. Well, what is it then? Mm-hmm. It's functional muscle. It's behavioral. Mm-hmm. And that woman would have said something like, I got divorced. I went through a couple years of emotion.
Yeah.
Oh, okay. Do you have 8 weeks? Can we fix it? Oh, okay. Let's just fix it. And we went through stretching exercises, simple things that are chest voice based, because she was trying to find her high head voice, but the joint wouldn't open up to give her high head voice control back. So we had to go through the bottom of the register and get the movement of the joint at the cricoid back. And then her voice came back within 8 weeks.
Isn't that brilliant?
My C's again. And at 66 instead of at 50. And that's it. It's like, go back home and enjoy.
A lot of the singers that when they ask me, okay, who is Aaron Lone? What does he do? And when I say, he actually gets in there and he massages and he listens. I said, he's, the voice guru. And singers notoriously say to me, wait, he touches your throat? And I say, well, how else are you going to get? I said, if you have a sore muscle in your arm or in your back, you're going to go to a massage therapist. Why would you not go to a massage therapist for your voice and a specialist that knows what he's doing? And some of these people just say, oh no one touches my throat. Yeah. And it's just so weird. I can't comprehend that, but I always say, just try it once.
I was that person. I was like, you're not touching my neck. Do you know how much this thing costs? I mean, and then when I was actually even really nervous the first time the physical therapist got in there, because I thought, do you really know what you're doing? I mean, are you going to hurt me permanently? And it took a little while for me to understand, but they got in there. I mean, they did. And now they taught me these things so that, like what you said, hurdles, if a hurdle kind of comes back in for whatever reason, emotional, whatever, I know exactly what I can do on my own while I'm on the road, because we also have to have those tools, because we can't always have right, traveling with us. So.
Well, and that's where we work on those first few sessions to try to figure out what's your repetitive negative. Like if you're coming back to a problem, what is that problem and how are you going to try to steer away from that if it's 2 months from now? Right. Because even if it's emotion, we can drive away from emotion by using our power, our happiness, by changing our emotion, meditation and relaxation and progressive relaxation techniques. But a lot of what we're trained to do, I wouldn't have taken either of you on in my first year. It wouldn't have been an easy confidence thing. I would have been going, okay, I'll do a little bit. It would have been much more passive. It would have been lighter, because there is that fear of what if. And after you, the head professor at the Mayo Clinic, the head professor at a big school in Wisconsin, in Madison, she would say in one of her textbooks, it takes a few years to master this. And once you get that confidence, then the opera genre taught me what the passaggio means. Like, we don't get any of that terminology if you're trained in the late 90s. Wow. And you have to learn that outside of that. So you're coming back into learning. You're going, okay, I don't want to say I don't know, but I don't know. So if you taught me something at that point, then we even learned from the weakness of a voice is maybe going to come into the sound this way. So it'll sound breathy, and it might mean that your larynx is elevated, creating a large gap at the back. And so it's like, oh, well, let's take and we'll delete some of these things so that we can start to go in before we actually touch your neck. Go, you're doing this exercise, which is elevating your larynx, or your breath is not allowing you to basically keep your larynx in a neutral state. So when we get it neutral, you have to have everything caught back up so that the body's caught up to the technique too. So there's been so much learning, and I learn from every day, and from all my students and patients, because it can be, well, a hidden stressor, you know, something very hidden in their mind or in their technique, and they didn't know they were doing something that could be tension negative, like damaging to their tension.
All right.
I remember my voice coach, Tony Manoli, you came once to a coaching that we had, and, you know, was really hands-on and feeling and listening and watching. And I mean, that was invaluable because you could see the repetitive mistakes that I was making. And instead of in 8 sessions or 10 sessions, you could boom right there, pinpoint it and say, this, Sandra, you're doing this wrong. Do you see why? Here's the mirror. And I mean, that's invaluable. And okay, us singers, we should probably know how to diagnose that, but we're too close to it.
Well, even that day when Tony's ears were hearing, his ears are so good, right? And my ears are dumb compared to his ears or your ears. No. And different. Then they're different, but we had to adjust something to create balance, and then the room filled with the right sound. And that's when I learned something that day. It was like, oh, I get what you guys were hearing, or absence of that is what you were wanting. I just know balance, symmetry. There was something moving one side more than another. I'll stop that muscle and relax it. And then all of a sudden things filled out. It's like, oh, okay, yeah, this might be leaning towards one weakness. And then we just started
but you took that time to really to learn and to educate yourself, and I thank you for that. And but so working with singers in general, you've worked with, I'm not going to name drop because you could, but you've worked with a lot of superstars and traveled with them and touched their throats right before they went on stage. What do you find to be the biggest common problem with not just opera singers, all singers that you encounter?
I thought about this, you know, I thought about laryngeal elevation being common in opera, you know, over producing head voice in practice, and just hours and hours of singing in head voice can lift and tighten the tongue root a bit. But most singers in all genres don't warm up their speaking voice. And I always say, if you were a guitarist, you would never play your guitar without tuning it first. You would never carry it around without a case. And you definitely wouldn't drag it behind you all damn day using it without playing it, right? Like using it as a hammer and using it as this and using it as that, push the door open with it. Like no one would ever treat their guitar with that kind of common space, common mind. We wake up with these tiny little 2.5 centimeter vocal cords and the small little tight muscles that are all set in elastic behavior behind them or in them. And there's this fancy inside of a watch that has to run perfectly. But we go and we battle with speech and talk to everybody on the planet. And we don't just give it a nice little gentle warm up in the morning and let it kind of warm up for our speaking voice. And then resonance and ease of the speaking voice will come true. But a lot of singers, they rest their voice too much. They think rest will help. They think speaking higher, I'll just speak up here and this will help me. No, it won't. It will not help you. Don't speak like a fairy princess. It isn't going to make your voice lighter or higher. No, it's all that stuff is a lie. And I don't care. It's not to hold back and not teach that, but we have to warm up the chest voice because that's where we talk. That's important. And yet I think it gets pushed away from importance because of certain genres. And if we just pick on rock they don't do anything then. Rock musicians don't do anything. Typically, they kind of like, well, I wait for my 4th song and then my voice starts to feel better. Okay.
Carrie, can we do that?
You guys can't wait till the 4th song for your voice to come out.
We're in trouble.
And yet you might practice for 4 hours in head voice and then not return to the chest voice and do some trills or some sound in chest voice to return the muscles and the joints back to normal function. So we can overdo the practice of one sound, and then we got to kind of build back the balance, that balance of laryngeal muscle. And sometimes it's stretching. If you're doing jaw tension or tongue tension, we could just stretch before, stretch after. Get up, stretch your tongue, go into a tongue curl back exercise and just create space and just get blood flow and circulation. But it's often we blame the voice and we just call it a voice. Like, what is it? Your tongue, your jaw, your voice box, you squeeze a little bit? Do you have tight rib cage? Do you have tight hips? There's certain things that could really play a role in different voices depending.
Mm-hmm. That's interesting. Thank you.
Mm-hmm.
All right.
You know, with all this time off that we've had because our jobs are, you know, non-existent at the moment, especially in the United States. Let's say I knew I had a gig that I was going to sing, I don't know, in November. So I have about 3 months and I have not been singing very much. So what would you recommend for those of us that need to get going again to start using it again safely?
The general rule is you're going to warm up as you work the vocal cords skin. Your skin on your cords makes sound. And then under the skin is muscles and a ligament system, right?
Mm-hmm.
So we can think of the skin needing to be conditioned, but part of what I thought of in sort of building up an artist again is their skin is going to be a little more sensitive because you haven't been using it. So we use the chest voice in that way to get the cords to seal, and that'll start to condition heat into the skin. But you're conditioning the skin initially. So you're allowing your vocal cords to come together and close and stay closed, create a lot of heat, a lot of vibration. And that should be pushed. It should be extended long and do it to a point where you can turn it up, turn it down with your breath and your body. If your body work is there, you're going to be fine. If you need to work on core release and some abdominal release and stuff like that, that's where, again, we work on core and body frame. But the first thing should be that we're going into trills for skin and warmth of the skin. And then we're stretching to a point where there's the true passaggio. So if you're stretching your voice, you're just doing a glissando. You're just going up sliding. We don't need to climb like that because it's typical that you're going to be assessing speed and accuracy of a vowel then.
Right.
That can drive you crazy, right?
Yeah.
It can make you go into, I'm not there. So if you're just making sound on slide, there's no specific pitch, there's no exact vowel. You're working the register by working the flexibility of the voice and the joint, the cricoid, and then the vocal cords can come back into contraction and the elongation. We're not even in a resonance system yet, though, right? Yeah. We're not yet seeing are we balanced in sinus and feeling palate and expansion and the rest, right? So then you can go into your vowels with your resonance and your M's or your V's or all the sounds that connect with your singing teachers. And that's when your voice is ready. Now you got to work on your breath. You don't work on speed yet. You work on vowel accuracy, resonance, and breath work. So you're working on dynamic control, pianissimo to forte. You're creating a big meaty middle of your voice.
Mm-hmm.
And then you can start looking for the ornamental top. Once the cords are really hot, skin's really loose, the muscles are really relaxed and elastic, now you can start to use the speed of your brain and your voice will respond to it.
Okay.
The minute you go, I want speed for my brain to come out of my voice, but my voice hasn't had the exercise and the stretch and the ready, then you're going to be upset with the product. A lot of the times, once you come back and your voice feels dead on with your exercises and your vocalese, you can sing. And now it's just conditioning the singing, which you guys condition outside of most, right? You guys sing really complex for 3.5 hours. Like that's a dedication. So your dedication steps up from most. The rest of the artist groups, I just say, start singing your good songs, the songs that you're good at.
Mm-hmm.
Sing them well, because you've already set a brain and a memory to these songs. Mm-hmm. And you can identify mistakes in them. I wouldn't want you saying, okay, I've got a new piece I'm going to perform in November, so I'm going to start practicing right away.
Right.
Work on a piece of music that your body already has mastered. Mm-hmm. And in that, you're going to find the technique naturally. And so it is sort of like source what your body knows. You're going to feel good about it too. You get an emotional connection to it. And then that should find you as you come back into training for a new piece.
Would you say that if I was a singer listening to this, I would want to know, well, what does that mean? Like, does that mean that I can get back to that piece within that first day of singing? Or should I, for a week, just kind of be warming up the skin, as you say, and warming up the muscles? So it's kind of little by little until you finally feel ready to move into maybe more resonance or maybe the song or whatever. Am I right in that?
Yeah, because at training camp, no one gets to throw a football. No one shoots a puck at a goalie. Like, you're training your legs, your ankles, your wrists, your arms. You're training the body so that they don't go into an energy that is either stiff and then you can't do anything.
Right.
Or you just get sad. You shoot the puck and it doesn't go anywhere. Like, that's going to be a sad day. Mm-hmm. So we don't want to push you over the limits and get into emotional negative. Mm-hmm. And yet sometimes singers are just like, but I can sing. Well, no, you're thinking of when you're 18, like you could sing. Well, now it's much more technical. It's got a job attached to it. And I don't want it to be that there's this trust that I should just be able to. It's highly fitness based. It's trained in. And so as you train, you're still improving your voice. You're still improving the length of your sound, mm-hmm. right? So you're going over the 20-second mark on one sound. Mm-hmm. You know your skin's light. You know your breath is down in the right spot. You know you're on then. But if you say, well, I only got a 12-second phonation time. Oh, wait, no. You got to extend that. You got to go longer because even your phrasing wouldn't fit in 12 seconds. So now you can't go, right? So there's certain bars that I measure out.
Yeah, that's what I feel like right now I'm having issues with. I've started back singing. Carrie and I both just struggled during COVID. We couldn't. But stamina now is the one that I feel like I'm still dealing with. And I've been exercising. We both have been exercising during this. And I think that did help stamina. How important do you think exercise is for singers, opera singers, any singers, and weightlifting too? I mean.
Yeah, I agree with exercising muscles because they'll respond faster to what you're asking them to do, right? Whether it's the back, lower back, the obliques, your abdominals, your pelvic floor, your hips, and the way they rotate at the sacrum. If we look at a bicep and say, I'm going to do arm curls for 5 days, okay, well, that's fine. You'll have a pretty arm. But beyond that, it's not that type of exercise that I look for. If you're doing squats or some sort of weightlifting, I want you exhaling so that you're blowing out to create core support and you're not holding laryngally. That's typically the weakness in exercise. Even if it's sit-ups, they're like, and that's your larynx. So if it's a slower sit-up and it's like, you're not engaging your larynx. So the weakness would be that you're holding your core super tight because you want to pretend you're thin, like tucking your tummy all the time. Right. It's expand the belly wall and breathe into the walls and make them expand out afterwards. Okay. We typically source that in meditation and laughter and the ease of the body and the brain. So I'm not body image negative. So I'm not holding tight. Therefore, I'm not going to be shallow and my chest isn't going to be in my breathing as a speaker or as someone that's just a bit more psychologically impacted by my mid body. Okay. So we do look at ballerinas and say they're terrible breathers, right?
They are. They breathe very shallow, don't they?
Because they're not allowed to let go of their core, ever.
Yep. So, wow. No, I know. No, it's interesting. Thank you. Yep. Well,
are there any vocal warm-ups that you find work for everyone, or is everyone really a specific thing?
Yeah, that's a good question. I think the exercise that probably gets everyone bin is lip trilling, right? If we pull on lip trilling in choir work or in pediatric choral and stuff like that, when young children are brought in, it is that some people can't and roll an R to do a tongue trill, or that today is straw phonation. So what we call semi-occluded vocal tract exercise, where you'd push air through a straw and hum and blow at the same time to create voice warm up. It's very remedial for someone like you or both of you, but it works. It's simple. It's in your car. It's there, and you're muted. Some of you are very loud, so it can be that you want. No, not you, Summer, but there's there's that
laugh loud. Come on.
but there's a value to a straw phonation exercise in an apartment building or in a space where you want to be a little quieter, but you have to know what you're supposed to be doing too. You have to or you have to trust what you're in as far as the chest register versus the head register. And you have to know, because the straw is muting or the water is muting the sound. When we do a lip trill, we could do it wrong in creating a lot of airy release. So it'd be like they start in head voice and there's a lot of air in that. I always have to lift up a bit to cheat, right? And if that's my falsetto, this is all my breath body doing it.
Yeah, but you can hear the partials in it. Yeah.
Yeah, and the voice is just vibrating to get heat. There's a little bit of motion in the joints that are rocking, but I'm not taking my voice up to a higher note now. So it's just starting to get blood circulating, get my breath underneath it, and get the skin to warm up. So that's usually the one exercise that I push, is a really forward lip trill. If you have to lift a little bit to get your lips and your jaw to relax, it would be to and wiggle the jaw to try to make sure your breath is on.
So this is always relaxed.
Yeah, even in your trill, if you push up here, you should be able to wiggle your jaw as you trill. Like a... So the jaw can do something else.
Yeah.
Nobody ever tells you that. I know. I stopped doing lip trills years ago because it caused too much tension for me. But I never thought about like, oh, well, actually, when you do the lip trills, you're not supposed to have the tension. Nobody ever talked about that. So it was never like, if you had said that to me now, I would have been like, nope, not happening. Because I know me.
If you hold it, which is what I have to do too with lip trills, I have to hold it, and I actually have to.
Yeah, I always pick up the cheek a bit, like just out here on the jaw. Like I'm way past my beard, but pick up the cheeks
here,
and then the cheeks and the jaw and the tongue can just go. I'm out, right?
That's what I always say to singers is that this jaw I always feel is down and back, relaxed down and back naturally.
Yeah. Mm-hmm.
Right? Then you can get over it. But if you're here, you can't get over it.
You could also shape a vowel in your trill, like.
Isn't that cool?
By just making the tongue go up and down, thinking those vowels.
Right.
You can create a little tongue release by doing that. And as you're climbing, get really distracted. It's like one of these things where you're just like, get out of it. You're not doing anything. You don't need to be hitting high notes yet. And as that jaw wiggles and the tongue moves, your breath has to be on or your lips will stop. I've always used the lips as this, your breathing stopped. And they're like, no, my lips stopped. I'm like, yeah, that's the breath making the move though. So you're and if not, it's your larynx contracted and shut the airstream off at the larynx. So it's like, okay, you just choked out the airstream that way too. Let's change the exercise. Let's come back down the ladder a little bit and wait. So, but lip trill can become very complex, right? Without it being just a general grouping of, okay, 70 or 80 people on a choir riser being told to lip trill. And typically it's all head down. That's training a head voice. I want to rehab a voice. I don't want to train a head voice. I want to rehab the muscles, release the larynx, create a space in the back of the pharynx so that we have the sound flooding out. But other than that, I do look at just tongue wear out exercises. If we got specific, it would be most opera singers have tongue tension.
Yes.
And that can be a big fight.
Yeah, big fight.
Never, ever.
No. Men's tension, men's tongues, men and women's tongues. They're like, they don't know it's stiff because it could be from clenching or grinding. It could be from their speaking technique. It could be, a million things. But when we look at it, it's let's do blood flow exercises and let's try and get it out of the way of even the sound stream.
Thank you. So, okay, 51-year-old woman here. I'm going there. Talk to us about menopause and how it affects the voice, or does it?
You know, I did do a lot of, you know, research maybe 5, 10, 7 years ago on this. I couldn't find anything really that's acute. So nothing happens quickly. You would see a studious singer as someone completely different than the average woman going through menopause, where they don't care about their voice necessarily, and some average females they'll contract in their cricoid because of emotion and emotional changes, and even the hormonal changes will fluctuate emotion just typically in a woman's cycle. But does it contract their voice? Does it bring tension into the voice over time? And what I'd see maybe connects to menopause in women's voices in general is a tickle cough or a throat clearing habit, where their cricoid stiffens and they get a little throat clear habit, like they get this little dry cough factor. Tension dynamics in that are caused by the cricoid and that joint at the bottom of the larynx. That's where we cough. So stiffness in that area, I feel, introduces spastic nature to that area, and that becomes a protective cough. It's not protecting anything. It's just supporting the emotional body. So we push out of it by making the chest voice work higher. And if we say we'll stop pushing our voice, I don't want to push my voice up high, I don't want to belt anything, I don't want to push my voice in exercise. Most people wouldn't exercise their voice anyways. And then they just, over time, 3 or 4 years, their voice starts to stiffen up a little bit, usually due to emotional changes. The mucosal changes, and we sweat more in hot flashes, and women go through all these things that change their release of water sometimes. But not in an opera singer. No, you guys overdo water. You guys overdo it most of the time. And you're the best at it, right? Your vocal cords, if you guys get a little bit of dehydration, you know it. If at the end of a rock tour, they're dehydrated like crazy, they wouldn't take care of it up until maybe some of the artists today really studying it a bit more. But I don't see an opera singer at a high level losing hydration because they are hyper focused on it. They warm up their voice. And I think the other population that don't sing don't hyper focus on hydration and don't warm up their voice, so they become more susceptible to slight dehydration and tightness in the CT joint.
Okay.
Mm-hmm.
But I feel like in that conversation, we have to talk about hormones, because hormones for women, I mean, even from, the minute we start our cycle till premenopause to postmenopause, I mean, that's a huge shift. So, and I know for myself that hormones affect my vocal folds, whether they're thick or whatever, I mean, on a monthly basis, because I just know over so many years of singing on them. So what are your thoughts on that, on the hormonal level?
Well, we know that the vocal cords during menstruation will swell a little bit. They get a little thicker. So for a dramatic voice, it's like, whoa, it's easier. If it were a lyric voice, it's like, whoa, where's my high C? Where's the spin on that high note? My voice is heavier. It's like a mezzo all of a sudden, and it's just for 2 days. So that whole, I think the changes monthly as you go through those, what did they used to call it, a dark day for a soprano? They wouldn't have let the high soprano sing on her menstrual days.
Oh, yeah.
Back in the like hundreds of years ago, they just kind of said, no, I'm not doing it. And they just called it a day off. You guys all sing through it. You'll manipulate your cycle. You'll manipulate things that make your body stay consistent.
Right.
And yes, hormonally or emotionally, you just fight. You fight through it. You'll fight with yourself and get through it, because you are performers. You're tough athletes. And when we look at that, it's just the voice swells and the veins appear a little bit more in the surface of the vessels. That can also change a little bit of the tone of the voice or the timbre of the voice. So we look at it as your vascularity. Is it at risk during menstrual or in menopausal years? Are there any veins very apparent? And if there are, we bring in surgeons. We try to say we'll watch them. But beyond that, it's just the swelling and shrinking and swelling and shrinking that comes with your hormone changes and your changes in through menstrual cycle.
Mm-hmm.
I don't know if I don't think there's any permanent swelling or changes that are permanent after menstruation is finished. Like that's when you're at that point going back to normal, and there's just a slower phase that usually is seen as atrophying, right? Because they stop using the voice the same way.
Okay.
So, but hormonally, you're more connecting to, are you ready to sing? And you feel like you can make your voice jump out even if you feel like not singing. That becomes you and your singing teachers, I think.
Mm-hmm.
I just thought that there was some kind of, at least in talking with older singers and their concerns, because the loss of estrogen causes huge issues for our bodies in general. I mean, just on multiple different levels, which we do not have to talk about on this video, but but just the loss of estrogen causes so many problems that I can't imagine that it doesn't affect that part of us too, especially as professional opera singers. I mean, the biggest complaint is that most singers, mezzos or sopranos, lose their top. And that all, to me, I mean, thickness of chords and trying to, the chords thin out as you go to the top notes. So if everything's so over thickened, then that can just lead to all kinds of issues, whether it's mental, whether it's, learning how to maneuver through that technically. I don't know if you can, we can totally disagree about that, but I just, I feel like there's something there with estrogen that causes a problem.
There's elastics. There's tissue that create an elastic bounce. So we do lose that as we age. Our skin gets less elastic, and that's skin. That's the skin on the cords. Mm-hmm. So say if we care for our hydration and we keep up with our elastic exercise, then that should keep you in shape without going to a warble or some aged voice that's basically the dryness has hit an 85-year-old woman and no return, right? There's no coming back to 40. Right. So, and we can plump up a vocal cord, we can fill it full of gel, mm-hmm. and make that voice return to a better sound or a slightly less old sound, which typically is a vocal cord wasting away. Like the muscles are getting smaller and the skin is getting a little bit more tight and shriveled up a little bit, like our skin on our face, or like a body that's getting a little shorter.
Right.
But I bet you could name a few that have sung into their 80s, 70s at least with elastic behavior.
Sure.
Because they keep training.
Yeah.
The training is it. If you do trills and scales and do all your training every day, then you haven't taken 10 years off to atrophy. And then you try to sing again after 10 years? No, it's not going to be the same sport. It's not the same thing. And I also think that there's accommodations if you are over 65, saying, I'm not going to do this much, I'm not going to do that as much. You have to do more, mm-hmm. right? A 35-year-old hockey player has to do more exercise to stay in the game than the 22-year-old.
Right.
And as you train more, as you keep understanding, okay, I've done these exercises in my morning or in my midday, and then I'm going to do these things which should be exact, mm-hmm. and I'm going to put it down, and I'm going to train a little bit tomorrow, and I'm going to keep adding those little training pieces so that my voice can come back to strong.
Right.
We use respiratory strength trainers for people with things like Parkinson's or degenerative diseases, where we just train their breathing with a blowing tool. You guys could do that through your trilling, through your exercise, and then that exercise creates breath support as well.
Is that the straw?
The straw, and any of exercises that make you make sound, you're blowing air.
Yep.
So, but most people in their 80s stop talking. They stop communicating with even family and friends because there's less communication. We just talk less. So that's where it's really an atrophy slide, past in the 80s and past. But most of us, the 70s are like the 60s now. We're still pushing it and still trying to keep everybody in shape fitness wise,
right?
Which I think is going to elongate a career.
Yeah,
I feel that. You and I, Erin, we've talked about it, and Carrie and I as well. I'm 51 now. The only thing that I've noticed being now postmenopausal is that it takes just a little longer to warm up, mm-hmm. and I have more of an upper extension. My voice didn't go lower, it went higher. Mm-hmm. But honestly, I know, Carrie.
You're a freak of nature, Sandra.
But Dolores Logic apparently had the same thing. So I don't know. If that's the worst of it, I'll take it.
Yeah.
You know?
No, and you're training still. So
Mhm.
it's the training. Say you speak more. You guys have all been speaking more over the last 3 months than singing.
Sure.
So the speaking voice is going to tighten in the middle of your voice box, and it's going to challenge your overtones in the voice. It's going to take away space that started to be the product of your overtone is I believe it's in the larynx, in the vestibule.
Yeah.
So say speech makes that vestibule shorter, smaller, or compressed. Then you go to sing, and it's your speaking voice that took your singing voice and changed it a little bit. So we release that and push your singing voice back in because the speech took it out. The speech made it problematic. Or one genre that you're singing in, one song and one piece is really more head voice dominant, and then there's some trick around the passaggio that you have to kind of climb through. So that one exercise could help that, but you haven't done it for the last 6 months because you've been channeling this exercise for this song or this work. So it is that there's certain things we're kind of picking from at times, going, okay, you got to stop doing that and do this more now because you're not doing that anymore.
Right.
And if it is that it's just like we got to start massaging our own jaw and stretching our neck and working the collar a little bit, because for me, I started to notice, okay, if I sleep, I pull the shoulder in and I sleep like this. And this is now in my 40s going, okay, shoulder, go away. And but that's me being a bit stiffer in my upper body. I wouldn't have felt that in my early 30s.
Well, talking about that kind of tension that can creep up in there, do you think that tight tension in the neck can affect your high notes?
It tilts the larynx in or down, right? Tension in the neck can basically pull back on your larynx like this.
The minute you get some little pull like that, you can't control your voice at all.
So it's in different spots that little muscle is going to pull. There's a group of muscles called the Pharyngeal constrictors, and they grip the larynx. They grab around the body and they make up the throat and grip on. And sometimes they're just at this grip instead of relaxed open. And so the voice box is supposed to be moved forward to get that to release.
Do you think that if someone, I'm just curious, if they sing that way for a long period of time, is that something that can never be undone once you have constricted so much and eventually, let's say the high notes kind of get lower and lower, or that C gets harder and harder and harder? Is that something that could be a permanent thing?
No.
It's always fixable.
Always fixable unless it's paretic or paralysis based.
Okay.
The nerve runs, right? So it's more like it's just like we all hold a bit of trapezius tension, right? So why? Because we're looking forward all the time. We're on a phone all day. We look down all day, and we want to be able to pull everything back and create a balanced neck and keep the head back, which is strengthening the rhomboids between your shoulder blades and some of the mid back. A lot of us work the front of our body. We work the abs. We don't work our back as much. When you're in a plank, you're working your back. If you're doing some sort of like a postural correction, you're kind of overdoing it, but it's going to come still with less tension in your neck. I see it as if someone had a long-term tension point in their body that isn't posturally negative, like they're not just turned and crippled by that. There's change that we can do that usually is correlated to a sickness or a stress event in their past. It could be 20 years ago though. And if they come into me and say, I sang like this at 25 and I'm now 45, like, okay, it'll come back. It's just, we just got to get that to release. Usually it comes back pretty quickly. It's rewarding therapy for that reason, because it's not like we have to change your whole life and put braces on for the next 10 years.
Right.
We basically release it and say, direct your voice or your focus of your voice to this. And a lot of people are like, oh my gosh, my voice is back. And if we get that statement, I'm like, you know your voice, right?
Yeah.
You're like, it's back there. I'm like, okay, good. That's it.
Cool.
Very common.
Do you have any massage techniques or therapies that you could recommend to all of us that are here at home that can't get in to see you, or and can you demonstrate them?
Yeah. I've been working on things that I'll start to I guess produce more of, which is how to self-release. My techniques have developed over 22 years to say, maybe I've got to make this simpler, because if I say, okay, release your inferior pharyngeal constrictor muscle, you'd be like, I don't know what you're talking about.
Well,
Hi.
some of us might, but
Then there's
Hi.
then there's people that won't actually feel confident enough to touch their own neck, where they're like, I'm not touching it. I don't want to touch it. Those people come to a therapist. You'll find somebody if you keep asking, like find the voice group in your city and then find what they direct you to. I like to do a twist. So when you grab your larynx on the sides, can you push it a little bit to the left? You got to move my beard out of the way.
yeah.
Push a little bit left, and then hook behind it with a finger. It shouldn't be sore.
Mm-mm.
You should be able to get behind there, right? And I'm talking while I'm doing this.
Yeah.
That's the inferior pharyngeal constrictor muscle. And you need that muscle to activate to sing in head. You need that to sing.
Okay.
And then I can switch hands, or I can just do this with this finger, and then I go with this hand over here, my thumb.
Okay.
But I'm behind my voice box, up and down like this behind my voice box,
Mm-hmm.
because it's supposed to be leaning forward.
Everybody with their hand on their throat can't sing.
If we bring it forward, it's like, oh, it's just
Forward and
blows out.
it's supposed to tilt forward and down a little bit too, right?
Yeah. And yet most of us that have this, we see the eyes go up and the jaw tightens and then the tongue lifts and then the voice pulls. We want to see if we can actually yank it forward. I call it the twist. I don't want it to be that you're pulling as much as you're just twisting it like that. And so I'm taking the larynx and pulling and twisting, but I'm just twisting it on its axis. And we can yawn. My mouth let go there and I'm yawning.
Oh, that's great. I know. Uh-oh.
Sorry.
Oh, yawning.
Cover your mouth, Carrie.
That's great, Erin. Thank you.
You'd be surprised how many people would jump like, oh, that hurts. So then we're like, okay, calm down. Now you also have a carotid artery right there. So if you were doing one side at a time, you have an artery feeding your brain. If you're trying to do both sides at the same time,
You're a hot mess.
yeah, you're gonna knock yourself out.
Done.
Don't push on both carotids, but
Okay.
you're in that space where the voice is just telling you, can you come in on the back side, come in on the side wall and get in there, and then pull a little bit or twist a little bit and see if it's got some buoyancy, because then you come out and your speaking voice may have a bit more resonance.
Mm-hmm.
And it may connect to, just the overall tone of your singing voice, the transitions in sound.
Thank you.
They taught me
That's
that.
a big one.
Yeah, they taught that to me in physical therapy, which was cool. But I remember when they first started working with me, they were like, let me know if you get a little dizzy or a little lightheaded, because they're learning my anatomy too while they're getting in there. And so they need to know if they're, hitting the carotid artery. I know they know where that is, but you know what I mean? They just need to make sure I'm okay. So.
Well, and I've had therapists try to train under me and they're just like, oh, I'm starting to feel nauseous, just feeling her pulse. I'm like, oh yeah, get out, you're done.
Hi.
And part of that is they're just not trained always medically, right?
Right.
If we have to do surgeries and we have to stick a camera in someone's nose, or you have to look at ugly tonsils or something. This is what I love doing. Most speech pathologists want to work with a 6-year-old that can't do an S properly, or that there's other areas like specialties in the autism spectrum or in stuttering, or there's so many hats in speech pathology, and maybe 1 out of 1,000 of us are voice therapists, maybe 1 out of 10,
Wow.
And so the Americans are advanced too. They've got singing voice specialists now with sort of the advanced, they get to call themselves in advanced ways so that singers know to go to them.
Okay.
Much more different up here. Just speech paths up here.
Thank you.
Mm-hmm.
So do you think then, we were talking, you basically are massage as well. Do you think full body massage is also very important for singers? Body work, all of that.
Yes, because it's the hips that connect to the alignment of the breath.
Okay.
And I have tight calves from my early days, or I have a hip flexor that again is part of my sleep weakness. I drive to work and I use my right hip quite a bit because I'm constantly like avoiding getting hit. So there's all those variables of how I hold my right leg more than I hold my left leg because of driving.
Okay.
you guys in your worlds might sleep wrong or sleep right. You might stand wrong or stand right. So then your body work will constantly tell on you.
Mhm.
And massage therapists are great. You know, they'll work out things where your rib cage down through your diaphragm, your obliques, all these muscles could be worked on to let go of your mid lower back.
Mm-hmm.
That will help the breath expand because you can push down further and make your viscera go down further. The same with the hips, just being more open. A lot of physios are now doing pelvic floor work.
Okay.
So that's another one with certain types of PTSD cases and certain types of trauma. They would do pelvic floor work and do a lot of work in there that helps the diaphragm relax, because we consider it to be a thoracic and a pelvic diaphragm, the two diaphragms.
That's cool.
Yeah, there's some really cool work with hips, and that's all even historic through Chinese medicine. They would say the hips affect the voice.
I would agree with
Huge.
that.
Huge.
Yeah.
100%, especially for me. Yes.
Do you think that you can heal a vocal cord injury through massage and speech therapy, or do you always recommend surgery, or is it a combo of both, or one or the other?
I've healed vocal cords, like polyps on vocal cords or polyp on a vocal cord, which typically when I look at the vocal cords and there's a tiny polyp, it's got to be accessible to therapy. The therapy has to be able to attack it. For example, a polyp won't disappear. If we rest our voice, it won't go anywhere. It's going to sit right there and it ain't moving. It ain't getting bigger, but it isn't getting any smaller either.
Mm-hmm.
So the therapy that I always recommend is just creating heat and stretching. So it's like start with a minimal amount of stretching just to get them used to it, because their voice is so raspy because of this interruption to the wave. But as about 6 to 8 weeks pass, there's usually changes. Some therapy, I say, let's just try therapy with no support from surgical or from medicine.
Mm-hmm.
New science would be that we take a polyp and we go in through a scope and we inject a little bit of steroid into it. And then even with patients that don't do therapy, they would say, let's wait 8 weeks and maybe it disappears just because the direct hit from the steroid.
Mm-hmm.
I'm always complimenting Dr. Osborne's injections. So they've got to do their exercises and accept the dexamethasone injection. And then we look in 8 weeks and see if it's gone. A polyp that is riding on the surface. So if my edges are here and the polyp could be my thumb, right?
Right.
That would be a very fixable polyp if it wasn't massive.
Okay.
Massive polyp, I'm not taking on therapeutically ever.
Okay.
We need the best surgeon to fix your vocal cords, and we need someone that does this every day. We don't want just some general ENT surgeon. So we need then a phonosurgeon. We need a laryngeal surgeon. And they will do a very finite, very microscopic removal of that polyp so that you don't end up with scar tissue.
Okay.
And the scar tissue can be just from old school techniques. But I'm always supportive of, if that person was surgically fixed with no therapy,
Mm-hmm.
they're at like a 40% chance of getting a polyp back again, because they don't know why it came and they didn't know what to do when it, like how do you manage your voice then? You're not managing it well enough.
Right.
And it could be just one scream or one yell or one cough, but it may be that their vessels are surfacing. It may be, we say don't take Advil, don't take Aleve. These things make your vessels surface in your vocal cords that increase the risk of hemorrhage,
Mm-hmm.
or they increase the risk of a polyp. So it's partly, if it's too big, if it's not in the right spot, there's no point in trying therapy.
Mm-hmm.
It would never work. If it was approachable, they're educated, they're willing to do the therapy, that's also there, right? Some people say, I'm not doing your stupid exercises. Send me to a surgeon. Okay, that's fine with me.
When I also
I've had
I got a sympathetic bump on the other side, because the one kept on, if the polyp was here and it kept on hitting the other vocal cord, then you also risk having not just one, but woohoo, bonus second one.
and with that, we have to remove the one and the other one will fade away.
And that's
Right?
what happened with me. Yeah.
We don't want to remove both of them then, which can often be misdiagnosed as nodules then, because we
Right.
see two bumps in a mirrored space.
Right.
But
Right.
we have to understand that in slow motion replay, you can see the insides of these things. You can see them rotate in the vocal cord skin, and then we can identify if it's gelatinous polyp or a hemorrhagic polyp. And then there's a complementary lesion on the other side that's just reactive. We call it reactive swelling.
And singers, if they are having, and I want to say this, and we all say this, because I get asked a lot, because I've been very vocal about my vocal injury, but
You are very helpful.
I think that if you do have any questions, singers out there, about your vocal cords, go to a professional, go to an ENT, have them scope you, have them diagnose it properly, and then ask them, what are my options? And you know what, I always say, start slowly with vocal therapy. And then if that doesn't work, then look at other ways that we can treat this. But you know, don't let this go too long, because the longer you let it go, the worse it's going to get. Yeah. And you know, there was such a stigma before attached to vocal injuries, vocal surgery, and all of that. And I think nowadays that stigma has been released, and people are freer and more talking about it. And I think that it's important that we talk about it here. There should be no stigma, because it's about vocal health.
Well, and I want my singers to see their own vocal cords.
Mm-hmm.
You can't go to a doctor and say, well, he said I had swelling. Oh, and he told me to take this. And then I went back, he said it was still swollen. You have to have a reason to have swelling. You have to have cause swelling.
Mm-hmm.
And so when we look for that, we go, okay, well, let's take a photo, and you can be your own doctor. You can see swelling in comparison to a picture in a textbook. If there's no swelling, that's the real trigger of its tension, its technique and its muscles. It's not your vocal cords. We can't blame those anymore.
Yeah.
But we often do. We blame them, and that's it. The doctor team wants to blame them too, but they won't go to a surgeon because there's nothing really there, right? Mm-hmm. And if you take prednisone too much, there's other issues. If you take antibiotics unnecessarily, it's like, well, here you're sick. I'm not sick. Something's wrong with my voice. I know sick, but I don't know what's wrong with my voice.
Mm-hmm.
So then we look at the voice, look at it under slow motion. There's strobe units in every city, everywhere. And once you see a strobe therapist or someone, an ear, nose, and throat doctor that has stroboscopy, ask for your video.
Yes.
Take your video with you. Take
not just photos.
Take a camera and go, and if they won't let you steal it from the hospital, put your camera up and have it recorded so that you could show someone else. Because there is a lot of help. You guys help so many other singers by word of mouth, by talking about problems that are real.
Yeah.
And for many years, decades and decades, you can see a hockey player limp into the dressing room and everyone wants to take care of them. Right. You don't get taken care of if you have a voice weakness. Yeah. It's like, oh, something's wrong. Push her
exactly.
away.
Bad technique. Oh, she doesn't sing well.
It's to carry your stuff if you're an artist with a limp. Right? They'll carry you in the room. But, oh, your voice? Oh, yeah, go away. You know, like, stop talking, drink some water, you're fine. None of that will work.
No.
When we look at, okay, something's wrong or something's feeling wrong, it may be, I did it today. I took a woman into my strobe room and said, there's nothing wrong. And she's like, oh, now we made progress.
Yeah.
Just take it off her mind. And she thought she had cancer at 21. I'm like, can't have voice cancer at 21.
So what would you say best advice to give to singers as a vocal specialist?
It goes back to think of your voice as your instrument. You polish your sax. You don't let anyone pound on your piano. You've got to warm this instrument up. If you're going to go out and party, do a warm up. It's fine. Your personality is part of your show, but you get to go out and party, do a speech warm up, a voice warm up, speak in the resonating space. Train your voice every day in the speaking zone to keep it away from stress, tension, speech tension, breath shallowness and weakness in breath that just comes with us in an environment that we feel a little bit not our best at, right? You guys walk on stage, that's your environment, it's awesome. It can be that you feel stressed just because you're walking into a room. I don't know, it's the door into a room, but your breath will go shallow and your voice will stiffen a bit. You got to prepare for that room. You had to do a warm up before you went to that space. And that'll keep you away from some of the things that we don't know are coming. They come over years or they come over even weeks of time. Mm-hmm. Even at the end of singing, the cool down becomes the most important for an elite artist like both of you, where you'd say, well, I've sung, drop it. And then you walk and go. No, you got to do some resonance, find your resonance, do some light chest voice from an F or a G below middle C to a G above middle C, just sort of rotate in that area. Just get the voice back to closure. Our head voice, we produce no closure. And so there's this held voice. It's tiptoeing a bit. It's in that state for a long period. Give it back that closure so that the voice feels comfortable again and your speech just floats out of you. Not this, I'm speaking on my core, I have to rest, and all the rest theory is just terrible. Don't rest.
No, I've never done warm down until last year.
Yeah.
In my whole career. I know, Carrie, can you
Really?
I never did it. No. No one ever taught it to me. Aaron.
It was such a thing with me that I got such a habit that I sometimes would forget I was doing it, like walking home from a show, you know, especially you're in cities, you just walk everywhere, and I'd be doing it and people would look at me like, what the hell is happening over there? Because I'd be doing it on my way home, because I didn't want to, by the time I got home, I really didn't want to think about singing or do any more singing or whatever. So it just became a part of even after like one of the after parties or whatever, after the party, after you talked, I always had to be careful where I placed the speaking, so that if I knew I was singing within a 48-hour period, again, for 3 hours, that speaking in those parties was something that was done in the correct way. But after that, I was always warming down, leaving, whatever, walking anywhere.
Yeah.
That nutter.
We'd stretch our leg if it felt stiff.
Mm-hmm.
We just don't connect stiffness to voice. We think of it as just a sound negative, and then we blame vocal cords.
Yeah.
But I do want to look at it as its stiffness of the tongue root, or its stiffness of my side neck, encroaching then, or pushing the voice box into a state of pull or tight.
Right.
Like, okay, well, you can just basically get blood circulating. And as the blood circulates, things settle down. You wake up the next day, you do again the same exercises that were basically your cool down, and you're like, okay, I'm back in voice again. I'll pull my voice out of my hat here in the afternoon.
Yeah.
So we just want to wake up in the morning, get the voice up. You're going to communicate as your own business managers and your own team. You guys have to do all the big talking on top of it. And a rock star, different. Sometimes a rock star is a little different, where they could sit in a bus and be quiet all day. Warm up comes at 7:30 to 10, and then they sing for an hour, maybe an hour and a half. And we can start it all again tomorrow at 7:00 at night. You guys have a little different career. It expects more and expects longer. So there's a little bit more needs as you go through cleanup all the time.
So that's the different techniques, do you think, between an opera singer and, in your opinion, a pop singer? I know that you talk about the chest resonance. We have talked about that with pop singers. It's more based here.
Yeah. The pop singers they don't ever go up into their head voice as much usually. So their tongue root and their jaw won't maybe create as much tension to just support that sound for long periods of time. But they do end up usually more, they're not as good at glottal attack patterns and being aware of when they're attacking their voice with certain lyrics and certain phrases that they're singing. Or their speech isn't really important at all.
Okay.
You guys get taught speech is important at some level in your training. It's more about like the cool guy and the rasp in the voice, and even females today are being seen in glottal fry all the time. Their voices drop in. So I was like, oh my God.
It drives me crazy.
And you're like,
watching television, like,
Yeah.
You can't get out of that problem. It's a problem then. You're going to be speaking. It would be like saying, I want to walk on the outside of my feet forever. Why? Why would you do that?
It's a generational thing. I see kids, a lot of women this age, and I don't know where it started or how it started or why it started, but, and I just say.
Pathology, we call it the Kardashian effect.
Well, I wasn't going to say that, but okay, there was, bam. Yeah, it is right on the chords, and 10 years from now, they're so going to regret that.
Yeah, and I even hear it. It's culturally really deep because it's in the radio host now. If you go to a young person's radio station, the female host wanted to drop in. They wanted to drop her voice.
Yeah.
And I guess when I started my career, when we coined the terms muscle tension dysphonia through my professor, he started all that. Before that, it was called vocal fatigue syndrome. Before that, it was called the Bogart-Bacall syndrome, based on Humphrey Bogart. Yeah. They all talk.
Oh,
That's cool. Interesting.
And I would have never watched Lauren Bacall or Humphrey Bogart ever, really. But when I learned that, it was like, oh, you guys just picked really pro people that everybody knew and said, oh, don't speak like them.
Mm-hmm.
And it's come back. It's come back.
Do we want to do some rapid fire now, Carrie? Do you have a few more minutes, Aaron, for us for some fun questions?
For sure.
All right. So, what is your favorite word?
Word? Oh, gosh.
Yeah.
I don't know my favorite word. I guess I've used the word trill more in my life now than anything. I call it trill.
Trill, okay.
I probably said the F-bomb more than that, but I said trill. Go with trill.
That's coming up. Hold on.
What's your least favorite
kids,
word?
right? So
4 kids. Whoa.
They won't watch this.
No. Least favorite word.
Rest.
Right.
Okay. What turns you on?
What turns me on? I get excited about. I don't know. I feel like it's like the spontaneity of a sport, like just the connections to doing something without rules, like
Okay.
if you punch a bag or if you leap and roll. That's what I always would have said. That's a huge thing. Like just let go of everything and just let it happen.
Oh, cool.
That's what I do.
What turns you off?
I know a couple answers for this one for you.
Yeah. Sound, obviously, after you guys know, after being tuned in so many years, certain sounds are just like, oh, I can't stand it. One would be really nasal sound, turns me off. Like, it's like, I'd rather hear rasp in a voice than a hypernasal speech pattern, but really tinny nasal, strident nasal sound is just like, oh, it just drives me crazy.
So that turns you off, and then that is also the sound that you hate the most. So what sound do you love the most?
Shouting sound, actually. It would be weird to say that, but the power of a voice naturally that comes out when we shout, that part of the sound is just powerful and very unhinged, very again released, but you can't try to make that sound. It just comes out of us, a cathartic sound.
Okay.
Mm-hmm.
Okay, the most important question of the day is, what is your favorite curse word?
I'm an F guy, I guess. I can use that in any way. As I'm not much about a speech pathologist in language because of that one word probably, but it's amazing when you work on patients with a brain injury, it still works, that word.
Really?
It's in our head. It's in our head. So sometimes you've got a stroke patient and they can't speak, and you do something, whatever, they can still blurt out that word.
They still say fuck.
See, Carrie said it for you.
Yeah.
Yeah.
Carrie, what's your favorite word?
Motherfucker.
Yeah. Oh, you extended. That's the extended.
Oh, yeah. So what profession other than your own would you like to attempt? Opera singing. No.
That's too hard. You guys picked a really hard game. I would want to, I don't know, it'd be something aggressive. I would probably go into something like boxing or MMA fighting.
Whoa.
Oh,
That's
okay.
hardcore.
That'd be fun.
Whoa.
Okay, I feel pent up aggression here. Like,
Ah,
talked about hitting a bag and boxing. And how many kids do you have? 4 kids.
They're still
Daddy-
young. They're still
Daddy's
young.
been home too much with COVID-19.
See, I took up fishing and I'm fine. It's fine. But it's like, oh, I got this. It's still my aggression.
okay.
Yep.
If I could do something to get paid for that, that would be okay.
Okay. All right.
But what profession would you not like to do?
Question would I not like to do?
Opera singing.
I think I was always inquisitive about what lawyers do, but now I would never want to be a lawyer. I just, it's not my style of day to day. And that would be a job I just couldn't imagine being excited about every day.
Okay.
Yeah.
And the final question.
Yeah.
If heaven exists, what would you like to hear God say when you arrive at the pearly gates? Oh, we've had everything, soup to nuts.
I'm sure. I suppose the first thing come to my mind is my brother died when he was 30. So I'd ask, where did he go? Where is he?
Where is he?
Yeah. Show me which direction do I go to find him?
Yeah.
Aw.
It's experience you go through like that you don't think about the next levels of where you end up, but I need to say hi. Yeah, that would be a quick hello.
Yeah, love that.
That's good. Well, we end on that note. Thank you for your time. It's so great to see you.
Yeah, it's great to see your face.
You're doing such amazing things. This is such a great info sharing.
I hope so. I mean,
Fun.
we want to touch just one life. Then I think we made a difference and help one person and let them know that we feel the same suckiness that they're feeling someday.
Yeah.
And to laugh a little bit and to find out some cool information and talk to fun people like you that we need to spread this information around. So why not? I mean, we're home. We might as well. Let's do it.
Exactly. And the more the better. It's always going to be this way. We want to share. We want to open up and let some of these secrets out. Make sure that people know what to do. And anyway, I always feel like helping. Always.
Thank you.
Love that.
On that note, thank you. And I hope to see you soon.
Yeah.
I'll call Katina. All right. Take care. Say hi to your family.
Bye. Thank you very much. Bye.
Bye.
Bye.